Hi, I'm Cheryl Martin-Schild. I'm the principal investigator of the study entitled, Does Too Much Factor VIII Predict Severe Stroke? I work at Tulane University in New Orleans, Louisiana, and we serve a majority of black patients. We know that too much factor VIII is an independent risk factor for developing stroke, and that this is particularly relevant among blacks. What this means is that if a person has too much factor VIII, it promotes clotting, because factor VIII is a clot-promoting protein. Normally we have a balance between bleeding and clotting, so that you're neither bleeding nor pathologically clotting. However, if you have too much factor VIII, this promotes clotting. Factor VIII works in many different ways. One of them is that it activates platelets to start sticking together. When platelets stick together, they can grab onto traveling red blood cells, and when this happens, a clot is formed. This is a diagram of the blood flow to the brain. Blood coming to the brain travels in arteries. Each artery supplies a particular part of the brain, and each part of the brain has its own special function. When a clot enters the circulation of the brain or forms inside of an artery of the brain, it leads to an obstruction. That means that there's no blood flow on the other side of that clot, and part of the brain doesn't get enough oxygen. A person will experience loss of function. It depends on which artery in the brain is affected, but a person might experience loss of vision or loss of the ability to communicate effectively. There may be loss of strength or sensation on one side of the body, or there may be a problem with coordination and balance. Sometimes the clot dissolves on its own, and blood flow is restored. When this happens quickly, a person experiences complete resolution of those symptoms, and we call this a transient ischemic attack, or TIA. Sometimes, however, the clot is persistent, and so the low blood flow is persistent. And when this happens, brain dies quickly. It's estimated that 2 million brain cells die every single minute during a stroke. We call this an ischemic stroke. And unfortunately, the person may have permanent disability. So what does this have to do with factor VIII? And what have we learned so far about factor VIII? Among patients we chose to test because we suspected that they had a clotting disorder when they were admitted with an ischemic stroke, we found that abnormally high levels of factor VIII is actually common. In fact, 2/3 of the patients who were tested had elevated levels. Elevated levels were most common in blacks and patients with diabetes. We also found that patients who had abnormally high levels of factor VIII had more severe strokes, and they had worse outcomes. But there are many gaps in knowledge. We don't know if we would find the same similar findings if we tested all patients with ischemic stroke. We don't know if we would find similar frequency of elevated factor VIII amongst patients who had transient ischemic attack rather than persistent ischemia. We don't know if factor VIII levels change over time. And we don't know if they're predictors of whose levels stay high and whose will return to normal. The goals of the proposed research will be to further investigate factor VIII in the setting of ischemia in the brain. We will hope to fill these gaps by testing all patients who have ischemic stroke not just those who are suspected of having a clotting disorder, measuring levels in patients who have transient ischemic attack, and compare those with patients who had persistent ischemia or ischemic stroke. We will sample levels over time to determine if levels are dynamic, meaning that they change, or if they're static. And if they're dynamic, we'll determine predictors of transient versus persistent elevation in factor VIII. This is our research team at Tulane University. I am Cheryl Martin-Schild. This is my partner, Dr. Rami El-Khoury, our nurse practitioner, Lori Schluter, and the coordinator of our program, Melissa Schwickrath. We hope you'll join Tulane in our battle to fight against stroke. Thank you.